Interesting. Okay, we now transition to group 3. I jumped a little too soon there on the end of your prior slide because the theme about communication is something that, and how we communicate the results of models is something that came up in group 3 as well. To summarize our discussion in group 3, Nick Macchione from San Diego.
And we indeed had a robust conversation, and Gary did a great job facilitating, and Amy was terrific in helping summarize some of these key points. So in our first slide, so we talked quite a bit about data needs, and the need, particularly when we talk about social and economic enablers of health. It's coming from many sectors, and the whole big data movement, open source data that was talked about, I think presents a great opportunity for modeling. The policy and practice side of me, though, also says there's a great caution, because policymakers will not remember the models, they remember the stories. And so we have to always remember that we have to harmonize to humanize, and that is how you harmonize through the modeling. We have to, at the end, humanize it in terms of real people, real lives, and that's really what grabs the hearts and minds of policymakers, especially when you start bringing in issues around child abuse and adult abuse and other on the human services side that deal with life-threatening situations. This is really important when we look at the data and get policymakers engaged. In types of models needed, we talked about, in the domain of social and economic conditions, what are the models out there? This is, I think, an emerging area. We've heard some really great, insights this morning, but I think there's more work in this regard in terms of the social conditions. Is modeling, for example, the barrier to adopting the needed decisions and policies that are really needed, that really lack any type of modeling for us? What can we share? So all the challenges, I think, that we've talked about as it relates to the health side, in some respects sometimes gets compounded, I think, in social services, where, in my opinion, is in many cases lacking behind in health. In the whole big data movement. I think they're moving there, but it's lagging behind in the healthcare. And the issue here is do not only need models comparing interventions, we also need models that look at the synergies of these multiple interventions, the interplay. The system science is useful for the policymakers, as one of the participants talked about. Next slide. Funding, we talked quite a bit about. So what happens when you have a great model and you implement it, and how do you sustain it? And we've seen some terrific models out there, but the sustainability continues to be a challenge. So how do we make it where we can reduce as much of those barriers in terms of the financial sustainability? And so the open source models could be a potential solution. We're excited about that. That's some work we're doing, looking and doing in San Diego, I know, as it's happening across the country. But as you do that, you also bump up across the proprietary issues and issues of on the commercial side and the public side. And so, again, I think it was said repeatedly, you're only as good as the quality or the availability of your data. So our whole hunt to bring this data and to get the permissions and deal with the proprietary issues is a big issue in order to do effective modeling. Communication, as Dr. Wolf talked about, was a big part of our conversation. The whole policymakers' expectations, there are really no quick and dirty models. And I think JT just talked about it. When you're dealing with term limits for policymakers, the grim reality is they're not going to be here for the long haul. So how do you talk about something that may take, in fact, a decade or more with someone that is looking at 2 or 4 years? So we bump across the realities of policymakers to the realities that modeling takes time in some respects. That not all models are interactive, is a big issue, and then you can manipulate your model to do anything, so what good is it, quote unquote, by one of the participants. So you need to move towards a standardization. And this is going to be obviously very challenging. We talked about that people have fidelities to their professions, where they come from social services or the clinical or public health or mental health or housing. they all have their biases and their fidelity to how they've been trained, from their education to what their practice culture lends them to be. And so modeling in some cases can remove some of those challenges, stripping that away, but in other cases they have their biases. So how do you move towards something standardized when there's already some resistance to how they believe that their model from their profession and their viewpoint lends itself to being cross-threading. Speaking about cross-threading, the conversation across cultures, we talked about the translators, and I'll jump also to the bottom, that we need not only effective translation between modelers and researchers and policymakers, because truth is, that's an area that we probably need to speak more about the core competencies of those translators. How well do they understand the translation of science, but the whole art of communication and convening and influencing become very important. But also, how do you translate in communities? We talked about, Mary Pittman talked about, it starts in the community, that informs the needs. But there's translation going back and forth between research community, the practice community, policymakers, and this pivotal role is something that I don't think we've really examined enough of in terms of the development. And then skepticism. Modeling needs to be formalized to ensure trust, and then communicate. And I think that happens from the beginning. Engaging people early, having a transparent process. I think much of what we've talked about, we feel very strongly, because in this case, we're inviting people from the community to the health community, because we're saying this is really a culture of health and wellness, but they see this a little bit jaundiced, that they're saying that you need us from human services to really improve health, when we know it's really not. It's really about the population movement on health. But dealing with that type of skepticism is very important to deal with. And I think that's one more slide. So next steps quickly. Starting again with the community engagement is critical. Figuring out what is the question, as Dr. Wolf talks about, you need to know what that question is. That really starts the basis by then figuring out the appropriate research questions and modeling. Consider the collective impact. We talk quite a bit in California, as I think across the country, of how do you really do collective impact as an approach. You have people at the table, you start with the conversation across the sectors, and I think we have a model in terms of collective impact on community engagement that lends us then to really look at further modeling in terms of the difficult questions across the community. Using health in all policies as a tool, another very important tool I think that many of us use. I like to say using wellness in all policies, because it's not just health or health care, because it talks about safety in all policies, it talks about economic well-being in all policies. But how do you do it where it's manageable? Because that could be far encompassing for any type of policymaker. And then modeling in this domain within health and human services can really help, we talked about, explain some of the causal pathways, which I think can inform, it's not the solution, that can be very helpful to policymakers. When we saw some of the work that Gary did, for example, in looking at what the cost factors are, some of those causal pathways to different issues can be very informative to policymakers, as well as the Rethink Health tools. And lastly, the communication from the beginning, again, just to kind of start and end on that, is extremely important. It's a new language. We're really defining a new language in this field. And so I think as we're bringing ourselves knowledgeable about this, it is also spending time with our community, our policymakers, informing them what modeling means. And kind of carrying this conversation into the broader community is something that we're attempting to do in San Diego, as I think many other communities are as well. I think that's